If you're experiencing sharp, burning pain in your nipples after breastfeeding or pumping, and then your nipples turn white or purple, I need you to watch this video. I'm Hannah, I'm a lactation counselor and a mom, and I want to talk to you about vasospasms. A vasospasm occurs when blood vessels tighten or constrict, reducing blood flow to an area. Some women are prone to this, and they might know that this is happening because before they were breastfeeding, they felt that pins and needles sensation in their fingertips or in their toes when they were really cold. Because cold temperatures can often worsen or trigger that restriction of blood vessels. Some symptoms you might experience are burning, pain in your nipples after breastfeeding or pumping. You might have a throbbing, like pins and needles sensation. Your nipples might change color after a feeding. They might be white initially and then turn into like a blue or purple color. And oftentimes women are diagnosed with thrush when this happens and none of the medications are working. This can occur if you are experiencing nipple trauma. So if your baby has a shallow latch, that can trigger vasospasms in your nipple. Or if your baby's in an uncomfortable position while they feed, or they have undiagnosed, untreated oral ties, or you're using a flange that's too big or too small. All of these things can lead to nipple trauma, which can then lead to vasospasms. So things to try. The first thing I would say would be to see a lactation consultant. Next is heat is your friend, not ice. So if you can apply some sort of heat right after feeding or pumping, that can often be helpful. I wouldn't recommend airing out your nipples in this situation because cold wind or a breeze on your nipples can exacerbate your symptoms. You can try warming up your nipple balm or like a little bit of olive oil or coconut oil to use that on your nipples to help with healing. Or you can do some pectoral massage to help increase blood flow to that area. There are some supplements that could potentially help, like vitamin B6 and magnesium, but talk to your doctor before starting any new supplements. There is one medication on the market that is approved to help with this situation and can be taken while breastfeeding. But before you start any medication, definitely see a lactation consultant to fix any latch or pumping issues, because oftentimes that can really help the problem and medication isn't necessary. I hope that's helpful.